Question 1. You are a pharmacist in California, and a physician prescribes a controlled substance for a patient. The prescription does not include the patient's address, which is a requirement for controlled substance prescriptions under California law. What action should you take? A. Dispense the medication without any further action. B. Contact the prescribing physician to obtain the missing information before dispensing the prescription. C. Return the prescription to the physician and request new prescription with the correct information. D. Dispense the medication and document the error in the patient's record. Answer. B. Contact the prescribing physician to obtain the missing information before dispensing the prescription. Explanation. Under California law, controlled substance prescriptions must contain specific information, including the patient's full address. This is mandated by the California Business and Professions Code, Section 4180, and the California Code of Regulations, CCR. If prescription for controlled substances required element, such as the patient's address, the pharmacist is responsible for contacting the prescribing physician to obtain the correct information before dispensing the medication. Dispensing the prescription without making the necessary corrections could lead to violations of pharmacy law and regulatory practices related to controlled substances. Question 2. Dr. Emily is a pharmacist working in a busy hospital setting. She is asked by a physician to compound a medication for a patient with a specific dosage form that is not commercially available. Which of the following is the correct action Dr. Emily should take in this situation? A. Prepare the medication as instructed without any additional documentation or oversight. B. Review the patient's medical history and confirm with the physician that compounding is necessary. C. Compound the medication and release it without consulting the pharmacist in charge. D. Refill commercially available medication and dispense it to the patient. Answer. B. Review the patient's medical history and confirm with the physician that compounding is necessary. Explanation. Compounding is practice that requires specific knowledge and skill, as it involves creating medication that is not commercially available. In California, pharmacy practice regulations under the California Business and Professions Code and the California Code of Regulations require that pharmacists must have valid prescription for compound medication. Before proceeding with compounding, Dr. Emily should ensure that the physician has determined it is necessary for the patient's therapy. The pharmacist must also confirm that the compounded medication is appropriate for the patient's medical condition and that all legal and regulatory guidelines are followed. Failure to do so can result in potential risks for the patient and regulatory violations for the pharmacy. Question 3. Scenario-based. Mr. Thompson is a 45-year-old male who visits your pharmacy to pick up a prescription for amoxicillin prescribed by his doctor for an ear infection. Upon reviewing the prescription, you notice that Mr. Thompson has a history of severe allergic reactions to penicillin. What should you do in this situation? A. Dispense the medication without any further action. B. Contact Mr. Thompson's physician to confirm whether amoxicillin is safe for him to use. C. Advise Mr. Thompson to take the medication anyway, as the doctor prescribed it. D. Contact the prescribing physician and ask them to substitute amoxicillin with different antibiotic that is safe for Mr. Thompson. Answer. B. Contact Mr. Thompson's physician to confirm whether amoxicillin is safe for him to use. Explanation. As pharmacist, you are responsible for ensuring the safety of the medications you dispense. In this case, Mr. Thompson has documented allergy to penicillin, which can cross-react with amoxicillin due to the similar chemical structure. California pharmacy laws and regulations require pharmacists to identify potential drug interact allergies and adverse reactions during the medication review process. Under the California Business and Professions Code, Section 4125, pharmacists must act in the best interest of the patient and ensure that any prescribed medications are safe and appropriate. The best course of action is to contact the physician for clarification and potentially recommend safer alternative rather than dispensing the medication without addressing the potential risk. Question 4. You are reviewing a prescription for a patient that includes an opioid analgesic. The prescription is written for a 30-day supply, but the patient has requested an earlier refill after only 20 days. The patient claims they lost their prescription, but there is no indication in the system that they received an earlier refill. What should you do in this situation? A. Dispense the medication as requested and note the patient's claim of lost medication. B. Refill the prescription, but only after contacting the physician for confirmation. C. Refuse to refill the prescription and inform the patient that you cannot honor their request. D. Dispense the medication, but only for A 10-day supply since the patient claims they lost the prescription. Answer: B. Refill the prescription, but only after contacting the physician for confirmation explanation. Under California law, early refills of controlled substances like opioids are highly regulated. Refilling an opioid prescription without the proper authorization from the prescribing physician could violate the California Business and Professions Code and deregulations. If a patient requests an early refill, especially for a controlled substance, pharmacist must verify the request with the prescribing physician to ensure that it is medically necessary and that the prescription is legitimate. The pharmacist is also required to document any unusual circumstances regarding the prescription and take appropriate actions to prevent fraud or misuse. Dispensing without verification could lead to legal and ethical issues. Question 5. A patient comes to your pharmacy with a prescription for a medication that is a non-formulary drug. You know that this medication is rarely used and its cost is high. The patient's insurance will only cover formulary alternatives. What is the best course of action for you as the pharmacist? A. Dispense the non-formulary medication as prescribed, regardless of insurance coverage. B. Contact the prescribing physician to see if formulary alternative is appropriate for the patient. C. Advise the patient to pay out of pocket for the non-formulary drug. D. Refuse to fill the prescription as the medication is non-formulary. Answer: B. Contact the prescribing physician to see if a formulary alternative is appropriate for the patient. Explanation: pharmacists have a responsibility to ensure that patients receive medications that are both effective and financially accessible. When a non-formulary medication is prescribed, it is important for the pharmacist to communicate with the physician to explore if a formulary alternative would be appropriate for the patient's condition, especially true if the patient's insurance will not cover the non-formulary drug. Pharmacists are expected to collaborate with other healthcare providers to ensure patient access to necessary treatments without unnecessary financial burden, in line with patient care standards and California pharmacy regulations. If no appropriate alternative is found, the pharmacist can work with the patient and physician to explore other options, including prior authorization, out-of-pocket cost considerations. Question 6. Scenario-based. Mr. Williams is a 72-year-old male with a history of hypertension and diabetes. He visits your pharmacy with a prescription for a new medication, lisinopril, for his hypertension. You notice that Mr. Williams is also on metformin for his diabetes. After reviewing his medical profile, you recognize the potential for a drug interaction between lisinopril and metformin. What should you do in this situation? A. Dispense the medication as prescribed and inform Mr. Williams to follow up with his doctor. B. Contact the prescribing physician to discuss the potential drug interaction and recommend an alternative treatment if necessary. C. Advise Mr. Williams to stop taking metformin immediately and start the new medication. D. Dispense the medication but suggest Mr. Williams to check for any symptoms of drug interactions. Answer: B. Contact the prescribing physician to discuss the potential drug interaction and recommend an alternative treatment if necessary. Explanation: as a pharmacist, it is essential to identify and address potential drug interactions that could affect patient safety. Lisinopril, an ACE inhibitor, can interact with metformin, potentially causing complications such as hypokalemia or worsening renal function, especially in elderly patients like Williams. California pharmacy law requires pharmacists to perform a drug utilization review to identify potential interactions before dispensing any medication. If a potential harmful interaction is detected, the pharmacist must consult with the prescribing physician to discuss alternatives or adjust the treatment plan to ensure the patient's safety. This approach follows the patient care guidelines set forth by the California Pharmacy Law. California Board of Pharmacy. Question 7. During a patient counseling session, you find out that a patient is taking several over-the-counter medications alongside their prescribed medications. The patient is not aware of possible interactions between these medications. What is your primary responsibility as a pharmacist in this situation? A. Explain to the patient that over-the-counter medications do not affect prescription medications. B. Document the over-the-counter medications in the patient's file and advise them to consult their physician. C. Counsel the patient on the risks of over-the-counter medications and offer to check for potential interactions. D. Recommend the patient stop taking any over-the-counter medications to avoid complications. Answer: C. Counsel the patient on the risks of over-the-counter medications and offer to check for potential interactions. Explanation: as a pharmacist, you have a responsibility to ensure that patients are fully informed about the medications they are taking, including both prescription and over-the-counter medications. Drugs can interact with prescription medications, leading to harmful side effects or reduced efficacy. Under California regulations, pharmacists are required to conduct thorough counseling sessions to inform patients about potential interactions and to offer medication therapy management (MTM). This includes checking for drug interactions and providing recommendations to ensure safe medication use. Counseling also helps ensure patient understanding, which is a core component of patient care and safety. Advising patients to stop medicating without consultation or complete information could lead to adverse outcomes and is not an appropriate course of action. Question 8. A prescription for a patient has been presented for a drug that is classified as a controlled substance. The prescription contains all required information except for the prescriber's deregistration number. What should you do in this case? A. Dispense the medication and document the missing D number in the patient's record. B. Refuse to fill the prescription because it lacks the required D number. C. Contact the physician to obtain the D number before dispensing the medication. D. Dispense the medication as prescribed, but inform the patient about the missing information. Answer: C. Contact the physician to obtain the D number before dispensing the medication. Explanation: under both federal and California law, the Drug Enforcement Administration (D) requires that all prescriptions for controlled substances include the prescribing physician's deregistration number. This is part of the regulatory requirements to help prevent misuse and ensure that the prescribed medication is legitimate, according to the California Biz and Professions Code, Section 4180, prescription for controlled substance that is missing any required information, including the D number, cannot be legally dispensed. The correct action is to contact the prescribing physician to obtain the missing information before filling the prescription. Failing to do so may result in violation of pharmacy law and the potential for disciplinary action. Question 9. A patient comes to your pharmacy and presents a prescription for a non-controlled medication. After reviewing the medication history, you find that the patient has a known history of renal impairment. The medication prescribed has a dosing adjustment for patients with renal dysfunction. What should you do? A. Dispense the medication as prescribed, assuming the prescribing physician is aware of the patient's condition. B. Contact the physician to discuss whether dose adjustment or an alternative medication is necessary. C. Counsel the patient on the normal dose and ask them to report any unusual symptoms. D. Dispense the medication with no further action needed as it is not controlled substance. Answer: B. Contact the physician to discuss whether a dose adjustment or an alternative medication is necessary. Explanation: patients with renal impairment often require dose adjustments for certain medications to prevent drug toxicity and other adverse effects. California pharmacy law emphasizes that pharmacists must ensure that medications are safe and appropriate for the patient, especially when specific patient conditions like renal dysfunction present. The pharmacist has an obligation to contact the prescribing physician to verify the appropriate dosage considering the patient's renal function and to recommend an alternative treatment if necessary. This approach helps to ensure that the patient is receiving the safest and most effective treatment while preventing potential medication errors. Question 10. A patient presents a prescription for a narcotic analgesic and insists on receiving it immediately, stating they are in severe pain. However, you notice the prescription is written for a quantity of 90 tablets, which is unusually large for the patient's condition. What should you do in this situation? A. Dispense the medication as prescribed, as the physician has made the decision. B. Refuse to fill the prescription and inform the patient it exceeds the usual quantity for their condition. C. Contact the prescribing physician to verify the prescription and ensure the quantity is appropriate. D. Dispense only part of the prescribed quantity and advise the patient to see their physician again. Answer: C. Contact the prescribing physician to verify the prescription and ensure the quantity is appropriate. Explanation: controlled substances, especially narcotics, are highly regulated to prevent misuse and diversion. If a prescription appears unusual in terms of the quantity prescribed, such as an unusually high number of tablets for a single prescription, it is the pharmacist's responsibility to verify the prescription with the physician. The prescribing physician helps ensure that the prescribed quantity is medically appropriate and within standard therapeutic guidelines. Dispensing the medication without verifying could lead to potential misuse or legal issues. Ensuring patient safety is primary responsibility of the pharmacist in line with both California pharmacy law and federal regulations. Question 11. A prescription for a pediatric patient includes a medication that is not available in liquid form, but the prescribing physician has asked you to compound it into a suspension. The medication's manufacturer does not provide specific compounding instructions. What should you do? A. Prepare the suspension according to your standard compounding procedure without further consultation. B. Contact the manufacturer for instructions on how to compound the medication. C. Refuse to prepare the medication as it does not have official compounding instructions. D. Compound the medication using similar drugs' compounding instructions as guide. Answer. B. Contact the manufacturer for instructions on how to compound the medication. Explanation. When compounding medications, especially for pediatric patients, it is essential to ensure that the preparation is both safe and effective. If specific compounding instructions are not provided by the manufacturer, the pharmacist should reach out to the manufacturer or consult credible compounding resources. Improper compounding may result in errors, stability issues, or contamination of the medication. California pharmacy law requires pharmacists to ensure the safety, efficacy, and quality of compounded medications. If no official compounding instructions are available, pharmacists should not assume responsibility for preparing the medication without expert guidance. Question 12. A 65-year-old patient presents a prescription for a medication that has been prescribed in a dosage form e.g. extended-release tablet that the patient reports is difficult to swallow. The patient is asking if they can crush or break the tablets. What is your primary responsibility as a pharmacist? A. Advise the patient to crush or split the tablet to make it easier to swallow. B. Dispense a different form of the medication, such as a liquid, if available and appropriate. C. Recommend the patient take the medication with a full glass of water to ease swallowing. D. Advise the patient to contact their physician to ask for a different medication or dosage form. Answer. B. Dispense a different form of the medication, such as a liquid, if available and appropriate. Explanation. Many medications, especially those that are extended-release or sustained-release formulations, should not be crushed or split because doing so may alter the drug's release mechanism, leading to potential overdose or reduced efficacy. In California, pharmacists are required to provide counseling to patients regarding the safe use of medications, which includes advising against altering dosage forms inappropriately. If the dosage form is difficult to swallow, the pharmacist should seek an appropriate alternative, such as liquid version of the medication, or consult with the prescribing physician for an alternative formulation if one is not readily available. This ensures that the patient receives the proper therapeutic effect while minimizing the risk of adverse effects. Question 13, scenario-based. A mother brings in a prescription for her 10-year-old child who is diagnosed with a bacterial infection. The prescription is for an antibiotic that is commonly used in adults but has specific pediatric dosing guidelines. But after reviewing the child's weight, you calculate that the prescribed dose is appropriate. However, the prescription does not specify the dosage form, tablet, liquid, etc. What should you do? A. Dispense the antibiotic as tablet, as this is the most common form for adults. B. Contact the prescribing physician to clarify the appropriate dosage form for the child. C. Dispense the antibiotic in liquid form regardless of the physician's prescription. D. Refuse to dispense the medication as the dosage form is not specified. Answer. B. Contact the prescribing physician to clarify the appropriate dosage form for the child. Explanation. When dispensing medications for pediatric patients, it is essential to ensure that the medication is both safe and appropriately dosed for the child's specific needs. In this scenario, even though the prescribed dose appears correct for the child's weight, the dosage form needs to be clarified. It is not uncommon for pediatric prescriptions to different formulations, such as liquids or chewables, to accommodate the patient's ability to ingest the medication. By contacting the physician, you can confirm the correct dosage form, ensuring that the child receives the medication safely. California pharmacy regulations require pharmacists to ensure that the medication is appropriate for the patient's age and condition. Question 14. You are reviewing a prescription for a high-risk medication, warfarin, which has a narrow therapeutic index. The prescription includes instructions for the patient to take 5 mg daily. Upon reviewing the patient's medical records, you notice that they are already taking 2.5 mg of warfarin, with the most recent international normalized ratio showing a value at the high end of the therapeutic range. A. Dispense the medication as prescribed and inform the patient to monitor their inner levels. B. Contact the prescribing physician to discuss the appropriateness of increasing the dosage considering the patient's current inner levels. C. Refuse to fill the prescription as the patient's current inner suggests they are already at risk for bleeding. D. Adjust the dosage and dispense 2.5 mg instead of 5 mg, even though this is not the prescribed. Answer. B. Contact the prescribing physician to discuss the appropriateness of increasing the dosage considering the patient's current inner levels. Explanation. Warfarin has a narrow therapeutic index, meaning small changes in dosage can lead to significant changes in anticoagulation and potentially dangerous outcomes such as bleeding or clotting. If a patient's inner is already high, increasing the dosage may put them at greater risk for bleeding. Pharmacists must communicate with the prescribing physician to discuss the appropriate dose based on the patient's current inner value and overall treatment plan. California pharmacy law emphasizes that pharmacists are responsible for ensuring the safe use of high-risk medications, especially those like warfarin, where frequent monitoring and precise dosing are critical for patient safety. Question 15. A patient presents a prescription for an antihypertensive medication that is contraindicated in patients with a history of angioedema. Upon reviewing the patient's profile, you notice that they have previously experienced angioedema associated with an ACE inhibitor. What should you do in this situation? A. Dispense the medication and inform the patient to report any symptoms of swelling or difficulty breathing. B. Dispense the medication as prescribed and document the history of angioedema in the patient's profile. C. Contact the prescribing physician to discuss an alternative antihypertensive medication that does not carry the same risk. D. Refuse to dispense the medication because the contraindication is listed on the patient's profile. Answer. C. Contact the prescribing physician to discuss an alternative antihypertensive medication that does not carry the same risk. Explanation. When a patient has a history of a serious adverse reaction such as angioedema to a medication in the same class, in this case ACE inhibitors, it is crucial to prevent further harm by not dispensing a medication that could cause the same reaction. The pharmacist is responsible for ensuring patient safety, reviewing the patient's medical history and identifying potential risks. Contacting the physician to discuss an alternative medication is the best course of action. This aligns with California pharmacy law, which requires pharmacists to ensure the appropriateness and safety of prescribed medications for the patient. Question 16. A 45-year-old patient presents a prescription for a medication that has a well-known side effect of drowsiness. The patient is a truck driver and informs you that they need to be alert while driving. What should you do in this situation? A. Dispense the medication as prescribed and advise the patient to be cautious while driving. B. Contact the prescribing physician to discuss alternative medications that do not cause drowsiness. C. Dispense the medication and recommend the patient take it only at night. D. Refuse to dispense the medication as it is not safe for patients. You need to remain alert. Answer. B. Contact the prescribing physician to discuss alternative medications that do not cause drowsiness. Explanation. Medications that cause drowsiness can impair a patient's ability to safely perform certain activities such as driving. As the pharmacist, it is important to inform the patient about the potential side effects and consider their lifestyle and needs. In this case, the truck driver needs to stay alert while driving, so it is best to contact prescribing physician to see if an alternative medication can be prescribed that does not have sedating effects. This ensures patient safety and compliance with regulations regarding public safety. Question 17. You receive a prescription for an opioid analgesic for a patient who has a history of substance abuse disorder. The prescription appears legitimate, and the physician is known for treating pain. What should you do next? A. Dispense the medication as prescribed as it is, within your professional responsibilities. B. Refuse to dispense the medication and inform the patient of your concerns about misuse. C. Dispense the medication and monitor the patient for any signs of abuse. D. Contact the physician to confirm the prescription's appropriateness, considering the patient's history. Answer. D. Contact the physician to confirm the prescription's appropriateness considering the patient's history. Explanation. Patients with history of substance abuse disorder require careful management, especially when opioids or other controlled substances are prescribed. As pharmacist, it is your responsibility to assess the appropriateness of the prescription and ensure that it is being prescribed for legitimate medical need. Contacting the prescribing physician allows to confirm that the medication is suitable and that other alternatives have been considered to minimize the risk of misuse. California pharmacy law and regulations emphasize the need for vigilant monitoring and appropriate prescription practices, particularly with high-risk medications. Question 18. A patient with an allergy to penicillin presents a prescription for amoxicillin. What should you do in this situation? A. Dispense the medication as prescribed and inform the patient of the potential risks. B. Refuse to fill the prescription as amoxicillin is a penicillin derivative. C. Contact the prescribing physician to discuss alternative antibiotics. D. Dispense the medication with a warning label and advise the patient to report any allergic reactions. Answer. C. Contact the prescribing physician to discuss alternative antibiotics. Explanation. Amoxicillin is a penicillin derivative and can cause an allergic reaction in patients who are allergic to penicillin. As a pharmacist, you must take all necessary precautions to ensure patient safety. In this case, it is essential to contact the prescribing physician to discuss an alternative antibiotic that does not belong to the penicillin class. This is in California pharmacy laws, which require pharmacists to take proactive steps to avoid harmful drug interactions and reactions, especially in patients with known allergies. Question 19, scenario-based. A physician calls you to confirm the availability of a medication that is on backorder. The medication is prescribed for the patient who requires it urgently for the treatment of a life-threatening condition. The physician asks if you can substitute the medication with another drug from a different class. What should you do? A. Dispense a similar medication from a different class without consulting the physician. B. Refuse to substitute the medication and inform the physician about the backorder. C. Contact the physician to discuss suitable alternatives within the same therapeutic class. D. Dispense an over-the-counter alternative as it is likely to be effective. Answer. C. Contact the physician to discuss suitable alternatives within the same therapeutic class. Explanation. In situations involving urgent medical needs, such as life-threatening conditions, it is essential to work closely with the prescribing physician to determine the most appropriate alternative medication. Substituting medications from different therapeutic classes could lead to a suboptimal therapeutic effect or unexpected side effects. Contacting the physician allows for a thoughtful and informed decision to ensure that the patient continues to receive effective treatment. California pharmacy law and best practices emphasize the importance of collaboration and clear communication between pharmacists and healthcare providers in these critical situations. Question 20. A patient asks you for advice on using a non-prescription decongestant to help with their cold symptoms. The patient mentions they have a history of hypertension. What should you do? A. Recommend the decongestant as it is available over the counter. B. Advise the patient to avoid decongestants and recommend they consult their physician. C. Suggest a low-dose decongestant as a safer option for patients with hypertension. D. Dispense the decongestant but suggest the patient monitor their blood pressure closely. Answer. B. Advise the patient to avoid decongestants and recommend they consult their physician. Explanation. Many over-the-counter decongestants, particularly those containing pseudoephedrine, can elevate blood pressure and may be contraindicated in patients with hypertension. As a pharmacist, it is important to consider the patient's medical history when recommending non-prescription medications. In this case, advising the patient to avoid decongestants. Consult their physician ensures that they receive safer and more appropriate treatment for their cold symptoms, while also minimizing the risk of adverse effects related to hypertension. California pharmacy law emphasizes the need for patient safety and the appropriate use of both prescription and over-the-counter medications. Question 21. A 72-year-old patient with diabetes presents a prescription for a new blood pressure medication. The prescription includes an ACE inhibitor. What is the most important point to discuss with the patient before dispensing the medication? A. Advise the patient to monitor their blood pressure regularly and report any side effects. B. Instruct the patient to avoid potassium-rich foods while taking the medication. C. Inform the patient about the risk of hyperkalemia and the need for regular blood tests. D. Recommend the patient take the medication only at night to reduce side effects. Answer. C. Inform the patient about the risk of hyperkalemia and the need for regular blood tests. Explanation. ACE inhibitors are commonly prescribed for hypertension, but they can increase potassium levels, leading to hyperkalemia, which can be dangerous for patients, especially those with diabetes. It is essential to inform the patient about the risk of hyperkalemia and the importance of regular blood tests to monitor potassium levels. Patients should be aware of the signs of hyperkalemia, such as muscle weakness or irregular heartbeats, and report them to their healthcare provider immediately. This advice is in line with California pharmacy law and regulations for patient safety. Question 22. A patient requests an over-the-counter antihistamine for their seasonal allergies. The patient is also taking a prescription sedative for insomnia. What should you do in this situation? A. Dispense the antihistamine and advise the patient to monitor for excessive drowsiness. B. Refuse to dispense the antihistamine due to potential drug interactions. C. Dispense the antihistamine as it is safe to use with sedatives. D. Contact the patient's physician to discuss possible alternatives to both medications. Answer. B. Refuse to dispense the antihistamine due to potential drug interactions. Explanation. Many first-generation antihistamines, such as diphenhydramine, can cause drowsiness and interact with sedative medications, leading to excessive sedation, impaired cognitive function, or other dangerous side effects. As a pharmacist, it is essential to consider potential drug interactions when dispensing medications, particularly when the patient is already sedatives. In this case, refusing to dispense the antihistamine and suggesting alternative allergy treatments that do not interact with the sedative is the safest course of action. California pharmacy regulations emphasize the importance of preventing harmful drug interactions. Question 23. A patient presents a prescription for a controlled substance, but the handwriting on the prescription is unclear and some information is difficult to read. What should you do? A. Call the physician to clarify the prescription before dispensing it. B. Dispense the medication as written, as the prescription is still valid. C. Refuse to fill the prescription and inform the patient it is illegible. D. Dispense a smaller quantity of the medication based on what is legible. Answer. A. Call the physician to clarify the prescription before dispensing it. Explanation. In situations where the prescription is unclear, especially for controlled substances, it is crucial to ensure that all information is accurate and legible to avoid dispensing errors. California pharmacy law requires pharmacists to verify unclear or ambiguous prescriptions before dispensing any medication. Calling the physician to clarify the prescription ensures that correct medication, dosage, and quantity are dispensed, protecting both the patient and the pharmacy from potential legal and health risks. Question 24. A patient is receiving chemotherapy and asks you about a new medication they have been prescribed. The medication is a common antidepressant. What should you do in this situation? A. Dispense the medication as prescribed and advise the patient to monitor for any side effects. B. Inform the patient that antidepressants should not be used during chemotherapy. C. Check for any potential interactions between the chemotherapy regimen and the antidepressant. D. Dispense the medication and recommend that the patient stop their chemotherapy regimen if they experience side effects. Answer. C. Check for any potential interactions between the chemotherapy regimen and the antidepressant. Explanation. Chemotherapy can interact with many medications, including antidepressants, which may impact the effectiveness of treatment or increase the risk of side effects. As the pharmacist, it is essential to check for any potential drug-drug interactions between the chemotherapy regimen and the antidepressant. By collaborating with the healthcare provider, can ensure that the antidepressant is safe and appropriate for the patient during chemotherapy. California pharmacy law emphasizes the importance of managing drug interactions to ensure patient safety, especially in patients undergoing complex treatments like chemotherapy. Question 25. Scenario-based. A patient presents a prescription for a non-formulary medication that is not available at your pharmacy. The patient is in urgent need of the medication for a critical condition. What should you do? A. Contact the physician to discuss possible alternatives that are available at your pharmacy. B. Fill the prescription with a similar medication that is in stock without consulting the physician. C. Advise the patient to find another pharmacy that can fill the prescription. D. Order the medication from your pharmacy's distributor, even if it may take several days. Answer. A. Contact the physician to discuss possible alternatives that are available at your pharmacy. Explanation. In cases where A non-formulary or unavailable medication is required urgently, it is important to contact the prescribing physician to discuss possible alternatives that can be dispensed immediately. This approach ensures that the patient continues to receive appropriate treatment while minimizing delays. Dispensing an inappropriate medication. Failing to consult the physician could lead to harm, particularly in critical situations. California pharmacy regulations emphasize that pharmacists play an active role in collaborating with healthcare providers to ensure optimal patient care. Question 26. A pharmacist receives a prescription for a medication that is listed as a controlled substance. The patient does not have an ID with them and claims they left it at home. What should the pharmacist do in this situation? A. Dispense the medication as requested since the patient is known to the pharmacist. B. Verify the patient's identity using other personal information such as address and date of birth. C. Refuse to dispense the medication and inform the patient that an ID is required by law. D. Ask the patient to return later with their ID and dispense partial quantity of the medication in the meantime. Answer. C. Refuse to dispense the medication and inform the patient that an ID is required by law. Explanation. Pharmacists are required by law to verify the identity of patients before dispensing controlled substances as outlined in the California pharmacy law and deregulations. Failure to properly identify a patient could lead to illegal dispensing of controlled substances, which may result in severe legal consequences for the pharmacist. In this case, the pharmacist should refuse to dispense the medication and inform the patient that an ID is required. This practice helps prevent drug diversion and ensures compliance with state and federal regulations. Question 27. A patient presents a prescription for a benzodiazepine and mentions they are also using alcohol to help manage their anxiety. What is the best course of action for the pharmacist? A. Dispense the medication as prescribed but advise the patient to avoid alcohol in the future. B. Dispense the medication but do not mention the risk of alcohol interaction. C. Refuse to dispense the medication and suggest the patient seek psychiatric treatment. D. Contact the prescribing physician to discuss the risks of combining benzodiazepines and alcohol. Answer. D. Contact the prescribing physician to discuss the risks of combining benzodiazepines and alcohol. Explanation. Combining benzodiazepines with alcohol can have serious life-threatening effects, including respiratory depression, excessive sedation, and even coma. As a pharmacist, you have an ethical and legal responsibility to ensure patient safety by preventing harmful drug interactions. In this case, it is crucial to contact the physician to discuss the risks of the interaction between benzodiazepines and alcohol and to determine whether an alternative treatment should be prescribed. California pharmacy law emphasizes the need for pharmacists to provide counseling and intervene when there is a potential risk to patient safety. Question 28. A 35-year-old pregnant woman is prescribed a medication for hypertension. Upon reviewing the drug's information, you find that the drug is classified as Category D in pregnancy. What should you do? A. Dispense the medication but advise the patient of the risks during pregnancy. B. Refuse to dispense the medication and inform the patient to consult their obstetrician. C. Dispense the medication as Category D. Drugs are generally safe for pregnancy. D. Call the prescribing physician to discuss safer alternative for the patient. Correct answer. D. Call the prescribing physician to discuss a safer alternative for the patient. Explanation. Drugs classified as Category D are known to pose a risk to the fetus, but they may still be prescribed if the benefits outweigh the potential harms in certain situations. However, when possible, pharmacists should always seek to minimize risk to pregnant patients. In this case, the best course of action is to contact the prescribing physician. Discuss the possibility of prescribing a safer alternative. California pharmacy law and FDA guidelines both support this practice to ensure that the health and safety of the mother and fetus are prioritized. The pharmacist has a duty to protect the patient from unnecessary harm, especially during pregnancy. Question 29. Scenario-based. A 50-year-old male patient presents a prescription for warfarin. He informs you that he has been drinking more alcohol recently due to stress at work. What should you do? A. Dispense the warfarin and advise the patient to limit alcohol consumption to moderate levels. B. Refuse to dispense the warfarin due to the patient's alcohol consumption. C. Dispense the warfarin and tell the patient to stop drinking alcohol altogether. D. Contact the physician to discuss potential adjustments to the warfarin dosage and educate the patient about the risks of alcohol interaction. Answer. D. Contact the physician to discuss potential adjustments to the warfarin dosage and educate the patient about the risks of alcohol interaction. Explanation: warfarin is a blood thinner that can interact with alcohol, leading to either an increased risk of bleeding or a reduced effectiveness of the drug. Alcohol consumption, especially in large or chronic amounts, can affect the metabolism of warfarin, potentially altering its anticoagulant effect. As a pharmacist, it is important to educate the patient on these risks and contact the physician to discuss potential dosage adjustments based on the patient's alcohol use. This approach ensures both patient safety and the effectiveness of the medication. California, pharmacy law requires that pharmacists intervene when potential drug interactions are identified, particularly with drugs like warfarin that require close monitoring. Question 30. A patient is receiving a prescription for an opioid analgesic. The patient has a history of substance abuse disorder and has previously been treated for alcohol dependency. What should the pharmacist do in this case? A. Dispense the medication as prescribed and advise the patient on proper use. B. Refuse to dispense the medication and advise the patient to find alternative pain management options. C. Dispense the medication but ask the patient to bring in a family member to help monitor usage. D. Contact the physician to discuss alternative pain management strategies and inform the patient of the risks of opioid use. Answer: D. Contact the physician to discuss alternative pain management strategies and inform the patient of the risks of opioid use. Explanation: patients with a history of substance abuse disorder, including alcohol dependency, are at an increased risk of misuse or addiction when prescribed opioid medications. As a pharmacist, it is important to exercise caution in such cases to prevent harm. The best course of action is to contact prescribing physician to discuss alternative pain management strategies that do not involve opioids. Additionally, the pharmacist should educate the patient about the risks of opioid use, including the potential for addiction and overdose. California, pharmacy regulations require pharmacists to evaluate the appropriateness of controlled substance prescriptions, particularly when there are concerns about substance abuse history.